Hello everyone, this is Dr Manas Chakrabarti. Today we will be touching on the headlines on vulval cancer. It's a rare or uncommon varieties of cancer, and today we are going to discuss its symptoms, treatments, prevention, and of course the causes of vulval cancer. So let's start. Many of you will wonder what vulva is. The vulva is basically the skin covered area on the outside of the women's genital area between two upper thighs. Now this term is not very well known in general population, and sometimes women refer to this area as a vagina. It is not true. It's outside the skin area is not known as vagina. Vagina is the inside canal, but outside area is known as vulva. Let's start with the symptoms. Now the symptoms could be long-standing itching, feeling uncomfortable down below, some discharges, or sometimes bleeding, or sometimes the skin breaks and causes a little bit of bleeding problems and causes ulcer as well. This may also present with a little bit of small lump, and it may be a pea-sized lump, or it could be a little bit bigger. The major problem is the social taboo, and most women thinks that having a little bit of itching is absolutely normal. Well, probably it is, but as long as it goes away for most of the times after effective treatment. But if the itching is keeping on coming back, or the discomfort is keeping on coming back, please to get yourself checked. What are the causes of vulval cancer? Now, vulval cancer may arise without any obvious cause, because not everything is very well known to the science. In significant number of the cases, the vulval cancer arises within the background of a condition known as lichen sclerosis. We are not discussing lichen sclerosis in great details today, but it is basically a little bit of itching which is persisting, discomfort which is persisting, and feeling of unusualness down below, and sometimes there are a lot of skin changes happening within that vulval area. This vulval cancer can also have a pre-cancer condition, just like the cervical cancer. Cervical cancer is further high, deeper, just at the mouth of the uterus, but the vulva is on the outside. So here we can see some pre-cancer cases which is also known as VIN, or vulval intraepithelial neoplasia. Well, you do not need to remember all these things, but all you need to remember is basically if you have got any discomfort or any problem which is not going away, get yourself checked. Now, this VIN or the precancer sometimes are associated with HPV, which is the human papilloma virus, a virus which is abundant in men and women alike. In those cases, the viral infection does not give any symptoms at all. So it's very important to remember that if you are trying to catch this HPV infection by looking at the symptoms, you will get fooled. Nowadays, with the HPV, we have got fantastic vaccines against HPV, which I believe will be working against the vulval intraepithelial neoplasia or vulval precancer, and of course vulval cancer as well. The investigations. What investigations needs to be done to confirm or to rule out vulval cancer? This cancer is basically a cancer of skin. A biopsy from that area will be usually good enough to diagnose this condition or to rule out this condition. Now, where from the biopsy will be taken and how much tissues will be removed, whether the biopsy will be from the side of the tissue or whether from the middle of the tissue, and these are a matter of careful consideration and calculation. Your doctor will talk to you regarding exact area of biopsy and the scientific basis of that before taking the biopsy, and there has to be a good plan for that. These biopsies are sometimes done in a naked eye vision. That means the doctor with their own usual eyes sees the area and take the biopsy. In some cases though, before the biopsy or around the time of the biopsy, or to investigate the cause of the vulval irritation or itching, a test is needed which is known as vulvoscopy. Vulva means vulva and scopy means camera. So it is, in a nutshell, it is about looking at the vulval skin area and to appreciate its changes under bright light and magnified vision. So these can be quite useful. So the biopsy can be done under naked eye vision or under vulvoscopic guidance. In the vulvoscopy, we sometimes use some friendly chemicals to check any skin changes on those chemicals so that the actual area of problem can be identified with reasonable certainty. Once the biopsy confirms the vulval cancer or vulval precancer, sometimes a CT scan or investigations are needed to check any glands are swollen or if the cancer has spread to other organs. So sometimes a CT scan or PET CT scan can be a valuable, important tool in these circumstances. If the cancer has spread into glands, that means the inguinal glands, which is the groin glands, from there as well, sometimes a separate biopsy test may be needed via needle or via removal of the whole of the glandular area. We are not going into the details, otherwise it will become very confusing for you. So let's move on to the next step. Like most of the cancers, the vulval cancer treatment starts with a surgery. So this surgery not only removes the area where the problem is, but also a wide margin of the area. This is because sometimes the cancer has got some satellite or small area, small specks of disease beyond the main tumor. So therefore, a margin will be needed as a whole as a treatment for this. Some cases, we also need to check the groin lymph nodes if they are involved in cancer. Because the vulva is very close to the urinary passage or potty passage, sometimes achieving this wide margin may not be feasible. In those cases, alternative ways of management strategies are used to compensate that margin. It is, of course, very important to reconstruct the area. Sometimes plastic surgery is needed. After the surgery, the biopsies are done in a more detailed fashion. In most of the cases, surgery is the only thing if it is detected early, but in some cases radiation or the external ray on that area or on the glandular area, some external radiation will be needed to complete the treatment. In some cases, if the cancer has spread beyond a level, chemotherapy will be needed as well. Now let's move on to the prevention. Of course, the prevention is to go to a doctor if you have got vulval symptoms, the irritation, burning sensation, discharges or bleeding problems or feeling something down below which is not going away. Go back to your doctor. Please tell the doctor that I have got this symptom which is persisting. In those cases, a vulvoscopy may be needed or some other tests will be needed to check the area. And it is not that difficult to prevent vulval cancer from developing, or if you are aware, to detect it at a very early stage. You can use a small mirror to check the vulval area after lying down on a couch in a private room, that it does not have to be outside your vision. It's your body, so be careful. We have only touched a few general headlines today. If you want to know more about any other topics, feel free to comment down below. We'll be happy to answer. Have a good day.